Do you know what disease is caused by eating gluten? The disease is called celiac Sprue disease. I asked my audience if they knew what it was, and they mentioned that it had something to do with the small intestines, and it also had something to do with eating gluten, which is correct. Celiac Sprue disease is a condition that damages the lining of your small intestines and prevents it from absorbing the nutrients. It is caused by eating wheats, rye, barley, and possibly oats. It can infect anybody from child to adulthood. Today I would like to inform you about the symptoms, causes, treatments, and the diet. I was personally treated for this disease, and my grandpa was also diagnosed with it. Let's start out talking about the causes of this disease. No one knows what causes it. The lining of the intestines have areas that help absorb nutrients. If you eat gluten foods, your immune system reacts by damaging these areas. You'll always be malnourished no matter how much you eat. It can develop at any age, from infancy to childhood. My grandpa was diagnosed with celiac Sprue disease about 6 years ago. He got really skinny and he was always sick, so they put him on a really strict diet. I was treated for this disease. I was never diagnosed for it. They just said based off my symptoms, I probably have it. Now I don't eat anything off the gluten-free diet. I eat whatever I want. I'm perfectly fine. But my grandpa, he has to keep on the diet. He does eat a little of other foods too. He has cheat days, but he has to be on the strict diet. It's very common to have your family members to have this disease. It's common in women and in men, but more women, which is pretty funny because I only know men that have this disease. It's also common in Caucasians and European ancestry. If you have celiac Sprue disease, it can cause other health issues like rheumatoid arthritis, diabetes, intestine cancer, and Down syndrome. Celiac Sprue disease has lots of symptoms. Let's take a look at a few. According to Medline Plus, symptoms will vary from person to person. Sometimes the diagnosis is not made right away just because everybody has different symptoms. For example, one person could have diarrhea, the next person could have constipation, and then the next person could not have any problems with their stools. More symptoms would be abdominal pain, constipation, decreased appetite, or lactose intolerant. Since the intestines don't absorb vitamins, minerals, and other important parts, other symptoms can occur, like bruising, depression, fatigue, growth delay, hair loss, itchy skin, and then if a child has celiac Sprue disease, a bunch of other things can happen, such as defects in tooth enamel, changes in your tooth color, poor weight gain, irritable and fussy behavior, and also delayed puberty. The third main point would be treatments. The doctors would perform a blood test, and if the test came back positive, an upper endoscopy is performed to sample a small part of a tissue from the small intestines. If it does come back positive, the doctors will recommend that everybody else in your family will get a test because genetic testing, it's simple, easy, and the celiac Sprue disease is very common if one of your family members have it, everybody else could have it. The doctors will want you to follow up after several months, and they will evaluate the responses of the treatments. If it comes back normal, it just means that you're responding to the treatments, so it's helping, you're just not being cured. You cannot cure this disease, but you can be healthier by having this disease. Symptoms can go away and the lining of your intestines can heal. Stay away from food, beverages, and medications that may have wheat, barley, or just gluten in it. Do not start the diet before you get tested because this can screw up the test results. The doctors do recommend to see a dietitian or a support group. Now let's look at the type of diet you need. According to the Celiac Sprue Association, you should follow a strict diet. Stay away from wheat, barley, oats, and rye. You could drink gluten-free beer, wine, brandy, tea, coffee, and fruit juices. It's okay to eat aged hard cheese, but you need to look at the ingredients label for like cottage cheese, cream cheese. If you just need a snack, you could have popcorn, or they're called rice wafers. If you are an ice cream fan, you could have sherbet or frozen yogurt ice cream, which is my favorite. If you love to cook, you could use olive oil, corn oil, butter, lard. Flour is okay to use, but make sure it's gluten-free flour. Meats are okay, and I also asked the audience if they have ever tried any of the gluten-free foods, and they all said no. Celiac disease can affect anyone from child to adult. No one really knows what causes this disease because it is possible to develop at any age. Symptoms vary from person to person, such as diarrhea, constipation, lactose intolerant, lower abdominal pain. If you are tested positive for celiac sprue, it is very important to follow a strict diet. There are dietitians that can help, and there are also support groups. It wouldn't hurt to even try the gluten-free foods. Maybe it will help prevent from getting celiac sprue disease later on.